So one of the biggest challenges in medical billing is that every insurance company has different expectations. So the same patient encounter may be reimbursed differently depending on the payer, and much of that knowledge lives only in the heads of experienced billers. So our goal with AICD-10 is to capture that knowledge and surface it before the claim is submitted. So from the dashboard, the platform continuously monitors every patient journey. So instead of waiting until the end of the billing cycle, it proactively identifies documentation gaps, reimbursement opportunities, and claims that may be at risk. And this is where those issues are surfaced. So rather than simply saying, there's a problem, AICD-10 explains why the claim may be at risk. If we've learned that a specific payer routinely denies claims without certain documentation or prefers a different coding approach, that intelligence appears here before submission. So let's look at an example. Right away, we know the payer and insurance plan, which allows the platform to apply payer-specific logic throughout the review process. The system recommends diagnoses and procedures, but every recommendation is backed by evidence. More importantly, if historical experience suggests that a different coding pathway has a higher likelihood of reimbursement for this payer, that can be presented to the reviewer as well. So the human remains in complete control and decides whether to accept or reject those recommendations. And that is per clinic. So if one medical biller knows that a specific path gets accepted or denied every time, it might be different from one practice to another, one specialty to another, and we have the opportunity to work around all of that. And then this is where that missing documentation actually becomes actionable. Today, we're using it for quality, but we want to expand it over time. So if the insurer commonly requires an additional clarification, supporting diagnosis, or quality measure, then the platform can identify that gap before the claim leaves the organization instead of after it comes back denied. And when appropriate, AICD-10 can draft that clarification, ideally using information already present in the chart and the documents. Then the provider reviews it, edits it if needed, and then the doctor can digitally sign it before it becomes a part of the legal medical record. Over time, every accepted recommendation, denial correction, and successful reimbursement teaches the system something new. And the result is that payer-specific knowledge becomes institutional knowledge instead of tribal knowledge, which helps every coder submit cleaner claims, reduce denials, and accelerate reimbursement. So one of the biggest challenges in medical billing is that every insurance company has different expectations. So the same patient